Several doctors with first-hand experience in Gaza have spoken to journalists at the United Nations. They recounted the difficulties medics face trying to save lives in a healthcare system that's collapsed. Al Jazeera's Gabriel Elizondo has more from New York.
All of the doctors who spoke to journalists here at UN headquarters on Tuesday recently returned from Gaza, so they have first-hand knowledge on the situation there. For some of them, they really wanted to put a human face on the suffering that they saw firsthand.
I want to focus on the people. This is Hiyam Abu Khadr. She's 7 years old. She is one of the victims of the war in Gaza. A bomb hit her family home, so her father and brother were killed, and her mother also was injured, and she had burned, and she sustained third-degree burns on 40% of her body.
Another doctor spoke of some of the medical supplies that are not reaching patients that need it the most. Simple things like pain medication and even an inhaler.
And this small vial of medicine here is a medicine that we use for sedation. Midazolam, Versed. This is something that we could be using for our patients who are there, who are in pain, we're trying to reset their fractures, we're trying to clean their burns. It's an incredibly painful process, and this is something that can help. Something this small, we're not able to get into the Gaza Strip because the trucks are stalled. Or if someone is having difficulty breathing, as you may suspect may happen as bombs are dropping and the air fills with smoke, not able to get a rescue inhaler in to be able to treat their asthma.
And a medical professional from the UK who's been going back and forth to Gaza for nearly 15 years says he was not prepared for what he saw on his most recent visit, especially when it came to young burn victims.
The most devastating burns in small children. One child that I'll never forget had burns so bad you could see her facial bones. We knew there was no chance of her surviving that, but there was no morphine to give her. So not only was she inevitably going to die, but she would die in agony. And what made it even worse, that there was nowhere for her to go and die. So she was just left on the floor of the emergency department to die.
Many patients in hospitals in Gaza have open wounds that cannot be healed properly because of a lack of supplies.
What does this mean over the long run? The longer this war goes on, the longer these wounds have to rot, and I mean really rot. The infections are getting worse and worse, and it's horrific. It's horrific for our providers, and it's absolutely horrific for these patients.
Palestinians are not suffering just from physical wounds, but also increasingly from trauma. Next month, a mission made up of mental health experts is expected to visit the besieged Strip. It's believed to be one of the first such missions to look at mental health issues since October, when Israel's war on Gaza began. Gabriel Elizondo, Al Jazeera, at the United Nations in New York.